Make sure to watch our video on posterior total hip precautions prior to this one. Posterior total hip precautions should strictly be followed for 3 months after surgery. You should check with your physician before foregoing them. First, move the back seat as far as it will go. Next, recline the seat about halfway back. Traveling in a SUV is easier to navigate than a small car. Square up to the seat. You should now feel the seat with the back of your legs or backside. Do not hold on to the door. It is not a stable object. You should hold on to the dash with your left hand and the seat with your right. Place your involved hip out slightly and sit on the edge of the seat. While you scoot back, make sure to bend your neck or you could hit your head. Use your uninvolved side to push yourself back. Remember, one of your hip precautions is to not have your hip joint past 90 degrees, so you will need to extend your torso back as you slide into the seat. Once you are in, you may unrecline your seat a little, but do not move it forward. To get out, reverse the process. If you are traveling in a low car, use some pillows to raise the seat up. Again, don't hold the door and watch your head. Of course, it is always a good idea to have someone help you. So we can continue to make these free educational videos, please subscribe to our channel.